Before we get started, I just want to acknowledge that ideally we would be outside. Many of us have kids who can't be vaccinated, so we're all keeping our masks on and would appreciate the same from everybody else in the room. And just want to acknowledge, ideally we would have our masks off while we're speaking to you, but we're still in a pandemic and we want to keep everybody safe. So just wanted to lay the groundwork there.
Hi, everyone. Thank you for coming to join us today. I'm Senator Lindsey Port from District 56. I represent Burnsville, Savage, and Northwest Lakeville. We are here today to announce the creation of the Reproductive Freedom Caucus. The work of supporting Minnesotans' decisions to choose if and when to start a family, to receive accurate medical information in both educational settings and during the healthcare process, and to access affordable reproductive care free from harassment and fear has been ongoing work in our communities across the state of Minnesota for decades. It's time that the legislature makes it a priority at the Capitol to support the work that's already being done in our communities. From comprehensive sex ed to the Patient's Right to Know Act, from supporting incarcerated parents to codifying the right to access an abortion, from trans healthcare to working with Indigenous leaders to access on care. Reproductive freedom is more important than ever. It affects all of our communities, and it is widely supported across all demographics. It is also more under attack than ever by extremist policies that don't reflect the realities faced by Minnesotans, nor the broad beliefs of Minnesotans. This caucus is forming with a commitment to support the work that's already being done in our communities, to fight these extremist policies, and to boldly champion reproductive freedom for all Minnesotans.
Thank you for being here as we announce the formation of the first ever Reproductive Freedom Caucus in the Minnesota Legislature. I'm Representative Kelly Morrison, and I've also been a practicing obstetrician gynecologist in Minnesota for 20 years. I see every day how critical sexual and reproductive health care is to the lives of Minnesotans. Access to contraception so people can plan and space pregnancies or control underlying health conditions, medically accurate sex education so people have the information they need to make informed decisions and consensual choices, bias-free pregnancy care and abortion care that is accessible, affordable, and free of medically unnecessary barriers. Minnesotans should be free to make their own decisions about their bodies and their families without interference from the government or anti-abortion politicians. As a doctor, it's my job to care for my patients no matter what. As a legislator, I pledge to work for the health and futures of Minnesotans. I could not be more proud to stand with my fellow legislators in the House and Senate and with advocates and people across the state for the reproductive health and freedom of Minnesotans. We recognize the imminent threat to abortion care that the Texas law, the Supreme Court, and our surrounding states pose. And we are united in our resolve to stand up for the rights of all people in Minnesota to access the care they need. So hear us now, Minnesota. We will not let what is happening in Texas and across the country happen here in Minnesota. We will work together to protect and expand access to the care people need to live healthy and thriving lives.
Jamie Becker-Finn, State Representative from District 42B, live in the Roseville area and am the House Chair of the Judiciary, Finance, and Civil Law Committee. And as an Anishinaabe woman, my ancestors and Indigenous people since first contact, the issue of Indigenous women having control over their bodies, which is perhaps one of the most fundamental freedoms that we have as people, has not always been a freedom that we have had. And this, so my grandma was the regional director for Planned Parenthood back in the day, but this is not your grandmother's choice caucus. This is a reproductive freedom caucus. This is above and beyond that. This is a caucus that will be intersectional in our scope and will be focused on the rights of all Minnesotans to access to care and access to rights that they all should have. Again, this ability to control our bodies and what happens to our bodies is perhaps the most fundamental right that we have as human beings, and that is what we're here today to push forward and champion.
Hi, I'm Athena Hollings. I am the representative for District 66B right here in St. Paul. And I am here today to talk a little bit about reproductive justice. When we talk about reproductive freedom, it's critical that we apply a justice lens to this because laws and policies that govern reproductive rights have always disproportionately impacted BIPOC individuals and communities. The United States is the only technologically advanced nation where maternal death rate is increasing. And it's often because too many low-income women and people of color can't access quality health care. Women of color fare worse than white women in every major health indicator, from maternal mortality to cervical cancer. These poor health outcomes show us that we are failing to provide equal access to reproductive health care. BIPOC communities, especially Black and Indigenous communities, have faced some of the worst and most egregious reproductive oppression, from forced systemic coerced sterilization to lack of access to reliable birth control, to lack of access to emergency contraception, and anti-immigration bias. Institutionalized racism, coupled with a history of reproductive oppression, has resulted in many African American individuals having healthcare issues and higher rates of reproductive health issues. We know that people with lower incomes are especially likely to lack control over their reproductive choices. And in Minnesota, 28.6% of African Americans live at or below the poverty line. This is why the Reproductive Freedom Caucus is in support of and will work alongside the newly formed Black Maternal Health Caucus, with a broad goal of empowering reproductive outcomes for all Black Minnesotans. I'd like to conclude with a quote from the 1989 pamphlet, "We Remember, African American Women Are for Reproductive Freedom." We understand why women seek safe legal abortion now. It's become a matter of survival. Hunger and homelessness, inadequate housing and income to properly provide for themselves and their children, family instability, rape, incest, abuse, too young, too old, too sick, too tired, emotional, physical, mental, economic, social. The reasons for not carrying a pregnancy to term are endless and varied, personal, urgent, and private. Thank you.
Good afternoon, everybody. My name is Erin May Quade. I am the Advocacy Director at Gender Justice and the Campaign Manager for Unrestrict Minnesota, and I'm really excited to be here with all of you today. 2021 has been the worst legislative year on record for abortion rights and reproductive freedom in history. And I'll say that again. 2021 has been the worst legislative record year for abortion rights and reproductive freedom ever. We don't need to look at Texas to see the impact of the anti-abortion movement. Here in Minnesota, we have numerous restrictions that impede our ability to access the care when we need it. And that's why we're excited to applaud this historic shift in tone and in movement from the reproductive rights, health, and justice movement with these legislators today. We know that the decision of whether and when to become a parent belongs to each individual Minnesotan and not the government. And these legislators are standing here today to say that decision does belong to each individual Minnesotan. They're getting involved to get out of your business. And we know that the movement has been doing this work for a long time. Unrestrict Minnesota is working to protect and expand access to abortion care and all reproductive health care in the state of Minnesota. And our vision is to achieve full reproductive justice in this state, which is an organizing framework created by Black women where every person can decide if, when, and how they become a parent, raise children they choose to have in safe and sustainable communities, and have gender freedom and bodily autonomy. So the movement has been here, and we are so excited to partner and work with these legislators to advance reproductive freedom in the state of Minnesota. This is a historic moment, and we could not be more excited to work alongside them. Thank you.
Good afternoon, everyone. Thank you for joining us. My name is Sarahtraxler. I am an abortion provider and the Chief Medical Officer of Planned Parenthood North Central States. I stand here proudly today with all of these brave legislators and advocates who are committed to protecting and advancing care, abortion access. Reproductive freedom is at risk in Minnesota and across the country, and it is imperative that legislators stand up for the rights of Minnesotans and make sure that we have bodily autonomy and we can decide the journey of our own lives. I see patients every day in the state of Minnesota who need access to compassionate, expert reproductive health care, no matter where they come from or what their demographic is. They need access to comprehensive sex education so they know how their bodies work. They need access to family planning so they can take control of their lives and their health. And they need access to safe and legal abortion so that they decide when and if to start a family. Our bodies, our futures, far too often are controlled by politicians who want to push their agendas into my patients' lives and into my exam room. When I sit with a patient in the exam room, my job, my sworn oath, is to give them the most accurate information about the health and their well-being. A lot of politicians want to be in that room with me, but that only jeopardizes the safety and health of my patients and really compromises how much they can trust me as their doctor. I want to thank all of you legislators who are here standing with us today, committed to making sure that we have a better Minnesota, that we can envision a future where we have control of our own bodies and our lives. Thank you.
Hi, everyone. My name is Magumi Ryerson. I'm the communications manager at Our Justice, which is an abortion fund and a reproductive justice organization. And I want to talk a little bit today about how abortion access actually impacts the people that we serve every day. So at Our Justice, we provide direct financial support for people seeking abortion care. And that means that every day, one of our staff or volunteers opens up a spreadsheet of requests from people who cannot afford their abortions on their own. And in 2019, we had 241 requests. In 2020, we had 455. And in September of 2021, we have over 700. In each case, we provide direct financial support for people's appointments, help them get connected to state Medicaid coverage, help requesters schedule appointments, refer them to other sources of funding, book hotel rooms, and provide travel support. We do our best to meet everyone's needs, but as a small organization, we're not able to meet the full financial cost of everyone's abortion care. And that's because society has put systemic barriers in place so that people cannot access abortion, including racism in healthcare, persistent income inequality, and a profound lack of resources for people of color and people with low incomes to have bodily autonomy. Abortion funds like Our Justice exist because our society has stigmatized abortion care so much that people do not feel that they have the community support to access abortion, and because our government has implemented policies that make abortion intentionally inaccessible. And I'd like to be really clear about that. The fact that abortion is inaccessible to the people who come to Our Justice is not a policy failure. Policies have been specifically designed to make abortion inaccessible, and in that sense, they work perfectly. The Hyde Amendment restricts federal funding for abortion access, which means that the half of the 50% of requesters that come from out of state can't get state coverage for their abortion care. The 24-hour waiting period and the medically unnecessary appointment that people have to schedule before accessing their abortion means that people have to take additional time off work, find additional child care, and also find a place to stay if they don't live near the metro clinics clustered in the Twin Cities. The physician-only law means that there are very few providers who can actually provide abortion care, which means that there are multiple-week scheduling delays for people seeking abortion care, which is especially important when an abortion care is very time-sensitive and it gets more expensive with each passing week. About the cheapest abortion that you can get in clinic starts at $700 and can go up to $2,500 or more. And that doesn't include childcare, hotel money, or lost wages. We're an organization fighting for reproductive justice, like so many of the people who have named here. That means a world, it's worth repeating, a world where everyone has the ability and autonomy to have a child, to not have a child, and to raise that child or themselves in a safe and supportive community. This Reproductive Freedom Caucus, as stated in the resolution, quote, has the power to end restrictions to abortion care that limit Minnesotans' reproductive freedom. It is incumbent upon you all to exercise that power. We really need to change the conditions that cause people to come to us for abortion assistance, because it's not sustainable right now. And as long as Our Justice is still fielding requests from people who cannot afford their abortion care, our work is not done. And I really appreciate you for expressing your commitment to reproductive freedom through the formation of this caucus. And I look forward to seeing what we can get done together.
Hello, everyone. My name is State Senator Jen McEwen. I represent Senate District 7 that it compromises most of the city of Duluth. And I am in my first term as a new state senator, and I am just thrilled to be here today with my colleagues in both houses of the Minnesota legislature. I'm so proud of this group. We're all coming together because all of us have recognized that we've come to a point now where we need to change the paradigm. We can no longer be playing defense. We can no longer be put on our heels and responding to the attacks, to the attacks on reproductive justice and reproductive freedom. So a lot of us over the past session have been talking about this new approach, and we've also been looking to our community and seeing the tremendous work that so many of the advocates and organizers who you've heard from today and who are joining us here today, they've been out front doing this work. And they've been calling for this new approach, a comprehensive approach to reproductive freedom. That means there's a place for everybody. There's a place for every Minnesotan in the movement that we're talking about. It crosses issues. It crosses different pieces of legislation. We're talking about comprehensive reproductive freedom. So we thought it is past time in the Minnesota legislature that we get together and form a formal caucus to fight for reproductive justice, to fight for reproductive freedom on behalf of every Minnesotan. It's long overdue, and we are ready to take that fight to the legislature and protect Minnesotans' right to reproductive freedom and expand those rights and strengthen and fortify those rights. So that's what we're here today to do. I'm happy to moderate questions that anybody has, and we are just so thankful for you joining us today and hearing about our new caucus. Thank you. Are there any questions?
Sure, I'll start.
Yes.
I mean, the basic one is, you know, a caucus is behind an issue or purpose, a unifying force. But is this really more a symbolic gesture, or how practically can forming a caucus actually change in any efforts to move legislation through?
Yeah, thank you very much for that question. I can take a shot at it, and perhaps other people have some responses too. It's not at all simply symbolic. This is a caucus that seeks to advance reproductive freedom, both legislatively and movement-wise. We are looking to coordinate and to work with community organizers, community activists, and to advance reproductive freedom in Minnesota. That's a real thing. So ultimately, yes, there are pieces of legislation. I am the lead author in the Minnesota Senate of the Protect Reproductive Options Act. We have a couple of other really great pieces of legislation, the Patients' Right to Know Act, some legislation about comprehensive sex education and Minnesotans' right to receive that information that is so crucial to their decision-making. So we have legislation, and we will be advancing that legislation and talking about what else we can do. So it's tangible, the kind of results that we're looking for, and we're ready to fight for real results.
I will add, so two things. This work really started last year and started with the incoming class of representatives and senators that we have. If you look at the work being done by particularly Chair Ruth Richardson when it comes to Black mother and maternal health, as well as my bill, the Healthy Start Act, fighting for the rights of parents who are incarcerated and giving birth, that work is already starting. That is, this caucus is meant to include all of those things, and those are important steps that we have already taken in advancing those conversations and advancing that legislation. And I think just overall, we didn't come in here into a press conference room just for the fun of it during a pandemic. We're very serious about this, and what we know is that most Minnesotans agree with us. Time after time, poll after poll, most Minnesotans want this freedom over their lives, and we are here affirmatively saying that we are here to fight for them.
At what point did the conversation turn from it's not merely enough to have just these individual pieces of legislation, but you needed to formally, bring together a caucus behind this?
Well, I think that the conversation has been happening for some time. I mean, we have advocates in this room right now who've been working on the Patients' Right to Know Act and all of the issues surrounding a lack of comprehensive sex education, making sure that doctors can be truthful and honest when they're advising their patients. So as you've heard during this press conference, there are a number of barriers to access. There are equity issues. There's a number of issues that people have been working on for some time. And so these conversations have been happening. And I think that, to your point, with the energy of this new class of legislators, I think it just perhaps gave it that extra oomph that we were ready to form a caucus so that we can help advocates advance the issues and the work that they're doing out in the community, do it in the legislature.
I think it's also important to note that I know our job is to represent and fight for our constituents, and after what has happened in other parts of the country, I know that I am hearing from my constituents asking, what are you doing to protect my rights? And so it is very timely, but the conversations were happening prior to recent laws in Texas.
And I will add as well, the things that we've seen be most successful in the legislature are places where the House and the Senate work together. And it was a commitment and very clear to us right from the beginning that we wanted this to be a place where we can work together, knowing that we are not going to be able to pass the same things in the House and the Senate doesn't mean that we shouldn't be working towards the same goals. And so we saw the forming of this caucus as a way for us to bring in the energy from the outside, bring the House and the Senate together, and really work towards a common goal.
Is it your expectation then that whatever legislation you do put forth will be supported by the entire DFL caucus in both bodies?
Well, I can't remember what's exactly in the handouts, but I mean, we have the support of Speaker Hortman, of Leader Franzen, of Majority Leader Winkler. They all have signed on to be part of this caucus. So that's where we stand, and we know that we have their support for this caucus.
Is this, are you guys doing this to get ahead of the possible Roe v. Wade going back in the Supreme Court at the end of the year? When the Supreme Court going to kick everything to the states? Is this why you guys are doing this?
I will say that certainly has expedited our decision and really put the urgency on this matter. It's why Minnesotans are talking about this now more than they have for decades. The bill in SB 8 in Texas, as well as the decisions that will be in front of the Supreme Court, really highlight the urgency of this work. And we know that Minnesotans are with us. They want us to protect these freedoms. And that is our commitment to work together, work within our communities and the organizations that have been doing this work for generations to make sure that we do protect Minnesotans' freedom to reproductive care.
And to bring it back to all the speakers that you just heard from, this is not simply just about abortion. This is about comprehensive reproductive freedom. We heard about, maternal health care. We heard about comprehensive sex education, the rights of our trans and LGBTQ allies and friends and relatives and neighbors as well. That is all part of this conversation. So it is not simply, a simple pro-con abortion conversation that we are trying to have here. We are bringing forward all of these conversations it's 2021. This is the reality that we all live in, and that's the fight that we're bringing forward. Any additional
Thanks a lot.
All right.
Thank you.
Thank you very much.
Stick around.